Dr. Mayberry here. We are going to start our discussion of the lower limb today. So I actually start the lower limb differently than your textbook does. I start the lower limb with the os coxae, or the innominate, okay, so your hip. So I actually put the sacrum in with the vertebral column on your landmark lists, which is just not the way the book does it, which is fine. So this is the innominate, or the os coxae. It's actually 3 bones. So that's the first landmark that you need to know, is these 3 different bones. So there's the pubis, there's the ischium, and there's the ilium. Okay? So the pubis, the pubic symphysis, is where your 2 innominates actually articulate. So be aware, I don't always have rights and lefts appropriately when I hold these up here, but they articulate like that. Okay? Despite the fact that this person would be completely unable to walk or function. There. So, pubic symphysis, okay, this is the pubis. So when you're growing as a child, these are 3 separate bones. So this is one of them. And all 3 merge here in the acetabulum and then along these ramuses and all of this. So it's a little complicated, but you need to know that this is the pubis. This is the ischium. The way you can tell the difference between the pubis and the ischium is the ischium has this ischial tuberosity, this big bump on it. The pubis is anteromedial, so it's in the front and it's medial. Excuse me. The ischium, think ish ass. You are sitting on your ischium. This ischial tuberosity is the bump in your butt that you can feel as you rock on your chair. Okay? So ish ass, ischium, pubis, anteromedial. That leaves the 3rd bone, which is the ilium, which is the blade of the innominate. Okay? So all 3 of them do meet, obviously, and in adults it looks like one solid bone, but it's really 3 separate bones. Okay? So that's your first set of landmarks, are those 3 bones. The acetabulum is the next landmark. Acetabulum means little vinegar cup. Sip vinegar, which I would never do and not recommend, out of this acetabulum. This is where the head of your femur articulates. So this is actually the ball and socket joint that is your hip. So the acetabulum. Okay? Alright, I'm just not necessarily going to go in the same order as your list goes. Okay? So I said that these 3 bones merge in the acetabulum, but these are ramuses, rami, bridges, between the bones as well. So if this is the pubis and this is the ischium, this is the ischiopubic ramus, or the bridge between the ischium and the pubis. This is the iliopubic ramus, the bridge between the ilium, the blade, and the pubis, iliopubic ramus. Okay? So a ramus is a bridge. This down here, I said, is your ischial tuberosity. So the ischial tuberosity is the bump on the ischium. The ischium itself is basically everything below my fingers right now, while the pubis, everything on the pubis is like everything up here right now. So the pubic symphysis, specifically, is where the 2 pubic bones of the different innominates are going to articulate with one another. When we talked about different joints, remember, there's a reason this is not one solid bone, and that reason is childbirth. So in childbirth, these actually can separate just a little bit because that is a fibrous joint. Okay, or a cartilaginous joint. Sorry. So that is that pubic symphysis. I'm going to move into the ilium. There are a lot of landmarks on the ilium. When I was taking my first anatomy and bone class, this was my least favorite bone because there were so many landmarks. So I mentioned when we talked about the hand that I was cutting down on some of the things you needed to know on the hand, because this is primarily a forensic class in addition to osteology. So if this were a straight up osteology course, there would actually be a lot more landmarks that you would need to know on the innominate, but I have cut it down quite substantially, believe it or not, for this course. So let's talk about the gluteal lines. Your gluteal muscles are your butt muscles. So gluteus maximus, minimus, medius. The gluteal lines are where those attach. There are three. There's the anterior, posterior, and inferior. On some of these bones, they are easy to see, and on some they aren't. I will never put a bone where you can't see the line at all on your lab practical. So as long as you know where they're supposed to be, if you see some arrows pointing to some bumps on the ilium, as long as you know which one that is, that's fine. Okay, so I will show you where they are, but realize that depending on which bone you're holding, you may or may not be able to see them super clearly. So that's another reason why we want you to trade bone boxes every day, so you're not looking at the exact same individual every day. And the plastic ones in particular, some of the plastic models don't really have these muscle markings much at all. Okay, so we are going to start with that anterior gluteal line because I think it's the easiest one to see. So in your body, if you sort of hold it like this is more or less what it is in anatomical position, which is going to help you orient yourself with these gluteal lines. So the anterior gluteal line, you actually can see it, so I'm not going to move this any closer until you've seen it. This is the anterior gluteal line, and it sort of curves downward. Okay, so it actually curves down here. Okay, anterior gluteal line, because if it's like this, that's actually toward the front of your body. Okay. The posterior gluteal line is actually back here. So this posterior gluteal line, you can see parts of it in there. Okay, posterior gluteal line. And then there's the inferior gluteal line, which is always my least favorite. But on this is actually a plastic replica, but it's actually relatively easy to see here. So now when I hold it like that, it's right in here. Okay, oops, moved the table. That is that inferior gluteal line. Okay, so you need to know where each of those are located. So if it's down here right above the acetabulum, it's the inferior gluteal line. If it's back here on the other side of what we'll talk about in a second, which is the auricular surface, that's the posterior gluteal line. And if it's up here, right, on the anterior edge, then that's the anterior gluteal line. Okay, so as long as you can orient this properly, you should be able to figure out which line I'm pointing to on a test. And that's going to help you, again, when we talk about your forensic casework, because I'm going to say, there's damage near the anterior gluteal line, and you need to know where that is when you do your report. Okay, so there are those. Let me consult my list. Okay, the iliac tubercle, and it's also called the crystal tubercle. If you look, this is the iliac crest. Okay, so the ilium is the blade, the crest is this outermost surface of the blade. The iliac tubercle or crystal tubercle is this bump right here. And it's actually the result of a ridge, a really thick band of bone within the ilium. So it manifests itself in this big bump out here. And this is something that we see with bipeds. We don't actually see this landmark in quadrupeds. So that's interesting. Let's see. The greater sciatic notch and the lesser sciatic notch are very important. So the greater sciatic notch in particular, we're going to talk about in detail when we talk about determining sex from skeletal remains. So this giant notch is the greater sciatic notch. Okay? The lesser sciatic notch is conveniently right next to it, and it's smaller. Okay? So greater sciatic notch, lesser sciatic notch. When I say I'm holding this in roughly anatomical position, I'm usually putting my thumb in that greater sciatic notch, and that's going to come back into play when we side the innominate as well. I told you the ischial tuberosity. I'm just going down your list, but I don't do everything in order because that would be too simple. The auricular surface. See this bumpy area here on the ilium? This is actually retroauricular space back here, but this is the auricular surface. So your sacrum actually articulates right here at the auricular surface. So now you know the articular areas of this bone. We have sacrum at the auricular surface, we have the other pubis at the pubic symphysis, and we have the femur at the acetabulum. Okay? So it's not too complicated considering how much there is to this bone. Okay, so that's the auricular surface and the retroauricular space back behind it. The pubic symphysis, I told you, I skipped the obturator foramen. So the obturator foramen is a foramen is a hole. So this is the obturator foramen. In life, there's a membrane in there, muscles attached to that membrane. But when it's just the skeleton, then all of that, of course, is gone. So it looks like just this hole, but it actually is a very important hole. Okay? And we'll see when we talk about sex determination that it actually is shaped slightly differently in males and females. So that'll be convenient. The iliac fossa is really just basically this surface of the ilium. So remember, a fossa is a dip, so it's just the dip along the ilium. And there are, hopefully you realize this would be a massive area for muscle attachment. So there are muscles that sit there. Okay, so those are your landmarks and your articulations, but let's talk about how to side it. And I told you that you need to remember your greater sciatic notch for that. So greater sciatic notch, thumb, okay? That's what you need. And you also need to be able to be a little bit goofy when you do this. So if you put your thumb in the greater sciatic notch and you pretend like this is an old-fashioned phone, you say, put that at your ear, hello to the obturator. Okay, I should be saying hello to the obturator. Okay, which means that this is a right. So if I put my thumb, my left thumb, in that greater sciatic notch, I cannot say hello to the obturator because the obturator is way over there. So, hello to the obturator. Now, if you are genuinely just afraid of looking goofy when you're siding this, still put your thumb in the greater sciatic notch, and you can just stand here and see, oh, does my femur come in there? Oh, it does? Okay, then it must be in the right place. So, you know, if you want to be a party pooper. But you can see on Gertie here that this is that pubic symphysis here. This is the obturator foramen. Here's the acetabulum. Here is that iliac blade. And then back here we have our auricular surface where the sacrum is articulating, and then if you come up and look at her in class, there is that retroauricular space behind it. So you can also see all of the gluteal lines, because all the gluteus muscles are back here. You can see these gluteal lines in here. Okay, so Gertie, I tell you in class, is arguably a better teacher than I am for osteology. She just is. So definitely come up and look at her, have some questions for her, I guess you could think of it that way. So do not be afraid to come check her out because she is very, very helpful. So this was a very complicated bone. I did take a lot of landmarks off of it, so there will be more in your textbook, but these are the ones that you need to know for your lab practical. Okay, see you in class.